Happier at home this morning. We're discussing the challenges of heart disease in elderly women.
Yeah, for more, we're joined as always by our good friend Deb Marcello with more for us this morning. Good morning, Deb. Thanks for chatting.
Good morning. Great to see you.
So let's dive right into this. Friday was Go Red for Women Day, a special day that, we celebrate every year, and we really should be talking about and celebrating probably more than that, because it is the #1 heart disease is the #1 killer among women.
It is, and it accounts for more deaths than any other disease combined, including cancers in women. And it's important to understand that it's so prevalent that once a woman is 60 years old or older, that they have more risk for heart or cardiovascular disease than men do. So I feel that it's focused on men so often because their symptoms can be very different from women. So it's an important thing for women to keep an eye out for.
Deb, let's talk about some of those signs and symptoms. You know, like you said, so often I think women kind of brush it off. Oh, it's fine. You know, this is nothing to worry about. It's just typical aches and pains. But really being aware of how you're feeling could save your life.
Right. And, this is what's really tough with older women. Sometimes those symptoms can be so vague or even absent. So if you're not feeling well, even if you're just having general malaise, that could be an indication of some cardiovascular disease. But we think about the actual typical signs of that: chest pain, jaw pain, but you have to also consider upper abdominal pain or throat pain. When I was an emergency room nurse, a woman was having a heart attack and her pain was in her elbow. So increasing awareness for your doctor if your family has a history of cardiovascular disease is really important. Knowing what your risk factors are as well, and trying to control anything that's those controllable factors. But if we go back to what the signs and symptoms for an older woman can include, and even women 40 to 60, they have the same incidence of heart disease as men. So that would include things like nausea and vomiting, dizziness, feeling short of breath, sweatiness. Our typical signs of heart attack when we see a man coming in is they're diaphoretic, which means they're sweaty. They may have some blueness to their skin. They have that typical chest pain going into their jaw or their left shoulder. But this is not always present with women.
Deb, because these symptoms can vary just really so greatly between both men and women, how many boxes should we be ticking before we say, okay, I need to go to the doctor, I should be at the ER at this point? How many of these symptoms do you need to have before you ask for help?
I would say don't go by the number of symptoms. If you are not feeling well, and I go so often by a person's gut feeling. If someone comes in to the emergency department and says, I just feel like something's really bad, it's probably going to go south quick. So you have to listen to your body, listen to your gut, and make sure that even if they're saying, oh, you're fine, pursue it. Just, a simple EKG will help. Some blood work can be diagnostic. So looking at your situation, knowing your body is really, really important. And then you always have to be your biggest advocate. I know this from my own family. You need to speak up. The doctors that work with you, they're a team with you. So make sure that you're advocating for yourself or advocating for your loved one as well. And if you just feel like you're not getting answers, just keep pushing till you get those answers. There's a reason you're not feeling great. So it's the type of thing that all it takes is doing some testing to rule it out. If you have some of those risk factors like high cholesterol, if you're a smoker, of course, that certainly adds to your risk for cardiovascular disease. If you have diabetes, if you're overweight, if you're inactive and don't exercise frequently, all of these things can be predictors of having cardiovascular disease, especially in women.
Such important information. So important to listen to your body.
Yeah.
Deb Marcello always coming with the information and the good advice.
Thanks
so much, Deb. We appreciate it. We'll put all of Deb's information on our website, foxrochester.com. Stick around when we